The general perception about the National Hospital Insurance Fund, NHIF, is that it essentially is just a medical cover that pays for a hospital bed.
But that one, we moved out of that back in a long time ago. We have never paid for beds.
With the increase of the premium rates in July 2015, I seek to find out what are the benefits of this medical scheme to Kenyans and how can they access the package therein. Cornell Juma, a border operator in the ever-busy Kisumu County, shows us his NHIF card immediately we prompt him. He says he diligently pays his 500 shillings required monthly by those self-employed to ensure he can access medical services if and when he and his family need to. Accessing services, though, has been difficult, he says.
Nimeambiwa ilikuwa ya outpatient, nikaambiwa lazima nijaze form ingine ya kuonesha kuwa wana register tena.
Filling this form, what NHIF says is necessary if members are to access outpatient services through NHIF, urging its close to 6 million registered members to choose their preferred hospitals for themselves and their dependents by visiting their facility of choice, where they will find selection forms, the nearest NHIF offices, or visit their website where a list of available facilities is listed.
In cases of emergency and you're in a hospital, which you had not chosen because of emergency, one is treated as an emergency, therefore the hospital is supposed to treat you. And in cases where they need to invoice you, then they invoice NHIF instead.
Gibson Kamau, NHIF's Public Sector Operations Manager, explains the benefits of the new look medical scheme, especially following concerns that Kenyans continue to languish in medical bills, unaware of the millions available in NHIF coffers for members.
In the government hospitals for inpatient, you do not pay a coin. It's a walk-in, walk-out.
For mission hospitals,
normal illness, you also do not pay anything to access the services in those particular hospitals. When it comes now to any other operation, there's a co-payment, and this co-payment ranges between 15,000 to 25,000.
And in private hospitals,
we pay a limit of 2,400 per day.
So I have to use it every month, that 1,000 shillings.
Engineer Kamau Ngumo uses a voice prosthesis to talk after his voice box was removed back in 2014. The engineer had been diagnosed with cancer of the voice box or larynx.
My sickness started as a usual sore throat.
When they discovered the cancer, doctors advised Engineer Ngumo to undergo several laser surgeries, which he did in 2011. Back then, though, his cover did not guarantee him treatment abroad.
So I had to raise my own funds from friends and my savings.
The cancer went away, only to return 2 years later, forcing the engineer to remove his voice box altogether, the only way he could tame the cancer before it spread. He used his NHIF cover to cover all his expenses during his treatment in India, including air tickets and accommodation for both him and a caregiver, an option currently available only for civil servants like him, as well as disciplined forces under their advanced scheme. NHIF says, though, that under its new chronic disease fund, members under the national scheme will also be able to access treatment abroad for up to 5 million shillings for diseases that cannot be treated locally.
Most people look at it that being that I'm not sick, you never know when you get sick.
The medical scheme has given Friday as the deadline to which members should have chosen a facility to access outpatient services, saying the exercise, once closed, can only be done again after 3 months. Evelyn Omboy, Citizen Business Center.